Oklahoma State linebacker Amen Ogbongbemiga probably had the coronavirus when he joined thousands of other people in protesting police violence against black people. He just didn't know it yet. Shortly after attending a recent Tulsa protest, the football player tested positive for COVID-19, the disease caused by the virus. "Please, if you are going to protest, take care of yourself and stay safe," Ogbongbemiga tweeted on June 2. Per Oklahoma State University protocol, Ogbongbemiga was quarantined on campus after his test. He added in a follow-up tweet the next day that he had protected himself while protesting, presumably by wearing a mask. Ogbongbemiga's case is one that experts and policymakers fear will be repeated in the coming weeks, as people protest in crowds in reaction to the police killings of George Floyd, Breonna Taylor, and others. The odds of catching the coronavirus at one of these protests is still an open question, and doctors, nurses, and public health experts across the U.S. have stressed that fighting for human rights shouldn't take a backseat to coronavirus worries. But if there are coronavirus outbreaks that emerge as a result of protesting in the days and weeks to come, figuring out who to contact, and how to contact them, to warn them they may be ill and putting others at risk of infection, could prove to be nearly impossible. Nurses and healthcare workers attend a Black Lives Matter rally in front of Bellevue Hospital on June 4, 2020, in New York City. Johannes Eisele, AFP, Getty ImagesMany epidemiologists have said that the risk of coronavirus infection at outdoor protests, as long as people are wearing masks and keeping a safe distance from others, may be small. But contact tracers, the people tasked with tracing and stopping disease outbreaks in their tracks, are still worried that there could be potential for coronavirus spread. One big worry is that many people coming down with the coronavirus are at their most infectious right before they know they're sick, meaning they might not stay home on their most contagious days. From my perspective, it's certainly concerning any time there's gatherings of people, mass gatherings, such as these protests. John Henry, a COVID-19 contact tracer at the Columbus Health Department, told reporters on a conference call last Thursday. The job of a contact tracer is to retrace the steps that someone with COVID-19 took while they were sick in order to determine who else they may have infected, and alert those people to quarantine. Ideally, tracing work stops outbreaks before they spiral out of control in a community, but there are nowhere near enough contact tracers in the U.S. to trace back every coronavirus infection right now. Contact tracers usually look at who was in close contact with a patient, living or working alongside them, taking into consideration if they were within 6 feet of someone for more than 10 to 20 minutes.